Hello, you're watching a short introduction to the Avatar health testing equipment. This is the main screen for testing. Here you have the hand diagram with points marked on it. These are the points we're going to test. But first, a short history. This work is based on work that was done by Dr. Voll back in the 40s in Germany. Dr. Voll developed a way of testing the acupuncture points. He was testing the skin resistance at these points, and he, through his observation of thousands of different patients, he developed this scale 0 to 100, where 50 stands for 100,000 ohms. That is a skin resistance measurement, and it would be 100,000 ohms is the normal skin resistance in a healthy functioning person. Any readings which will go above 60 or below 40 will signify an imbalance in the body. If a reading goes above 60, for example, like this, what we're seeing here is an inflammatory process in the body. The body's working too hard. If, for example, however, the reading goes only around 40, what we're looking at here is a degenerative or chronic condition in the body energy. In other words, the skin resistance has raised and the reading has got lower, and it's got lower because less current will flow across the point, signifying a degenerative or chronic phase in the patient. So, what are we testing? That's exactly what we're testing, is skin resistance or conductance. We are putting, with this probe, which I'm going to show you a picture of now, a weak electrical signal through the body. It's only 1.5 volts, so the patient doesn't even feel it, and we're watching to see what happens with the skin resistance. In this situation, that's a normal reading of 100,000 ohms, and it signifies that that area of the person is actually, in effect, in balance. So what are we doing here? Really what we're doing is looking at where the person is in or out of balance. Let's see how we go with this particular protocol here. Where the button is flashing, it's the lymphatic system. And that's what we're testing right now. I'm now going to apply the probe to the skin, increase my pressure gradually, and watch to see what happens. This person has a normal, healthy, functioning lymph system, which would also signify anything to do with the sinuses, with the throat. So if a person had a cold or a flu, what we'd see on that point usually is a raised reading.
Right hand lymphatic jaw drainage point.
I've just pressed a button on the probe, and the very next point that I'm testing is related to teeth and jaw, and I'm going to test again. This signifies a little bit of imbalance there. Now, you might ask, what is that about? Well, at this stage, we don't really know, but what we're seeing is imbalance. This could mean that the person's TMJ, temporomandibular joint, was out of balance, they were holding tension in that joint. It could mean that they had a problem with a root canal filled tooth in their mouth. It could mean that they clench very tightly. It could mean many different aspects, but that's an area that I'll discuss in the next video. The next
right
point,
hand lung, CMP.
is lung. We have a balance on that point. That's great.
Right hand large intestine, CMP.
Here's the next point. Well balanced.
Right hand nerve, CMP.
And now we see a strong imbalance on the inflammatory side on the nervous system. The next point we'll test, moving on.
Right hand circulation, CMP.
Circulation. Also a little stressed, a little out of balance.
Right hand allergy 1.
This is in normal range.
Right hand allergy, CMP.
Also not very balanced. There's some stress
Right hand
there.
organ, CMP.
This point relates a lot to liver and kidney, so there's an imbalance there, some stress happening there.
Right hand adrenal point.
Well, you would expect adrenals to be stressed if the nervous system is stressed. You see how quickly we're getting an indication of where the patient is in or out of balance.
Right hand triple warmer, CMP.
You might be asking, what does CMP mean? CMP means a control measurement point, and it's that point which Dr. Voll found through his testing of thousands of people that gave the most information about that particular meridian, energy pathway, or underlying organ system.
Right hand heart, CMP.
Heart is going okay.
Right hand small intestine, CMP.
However, we now have a stress also on the small intestine. I'm now going to just go up here to quick view, and I'm going to click here, and that will give me immediately a sorting of those points, and it will give me immediately an indication of where the imbalances are. So if we draw an imaginary line across at this point, you can see that we have the highest reading as central nervous system, the next one which is significant for liver and kidney, then adrenals, small intestine, circulation, and allergy or immune system stress. Now, how quick was that? Even with my discussion of it, we've immediately seen that we can very easily tell where the focus of imbalance is in our patient and where we need to address our first therapy. I will show you in the next video how we decide now what are the underlying causative stresses that are creating this imbalance in the person. At this stage, of course, we could come over here, we could save the session. Yes, we want to save it. We're going to add a new client here. This is a test client. And we'll just say OK and save that session. And then we can do a print up of this session. So if we just hit print here, I'm going to sort it. And we'll just go to print preview for now. So you see that you can very quickly print up the session for your patient. You can show them where the imbalances are and hand that to them, and so that they've got something, their test results in their hand as they leave your clinic. Okay, that's it for this stage. The next area that I'm going to show you will be into the item testing, but that's in the next video. So goodbye for now. Thanks for watching.